I am Dr. Preetham Kumar Francis, a Cardiology Specialist in Abeer Medical Center, Abu Hamur, Doha. September 29th is celebrated as the World Heart Day by the World Health Organization and all the heart association throughout the world. This day is being celebrated to raise the awareness regarding cardiac diseases among the general population. The people should be made aware of the reasons regarding the heart diseases and what measures they need to take to prevent heart diseases. As you know, heart disease is the leading cause of death worldwide, much more than cancers, accidents, stroke, kidney disease, diabetic deaths, all these together. So it is very important that we realize the importance of protecting the heart. Now let us see what are the diseases affecting the cardiovascular system. The most important disease is coronary artery disease, which leads to heart attacks. That is the main cause of cardiac deaths. The other diseases affecting the heart are heart failure, valvular heart diseases, then cardiac arrhythmias. Then the diseases affecting the circulatory system are systemic hypertension and stroke. So it is important to recognize the symptoms of heart disease early. Let us see how heart disease presents. Commonly it presents as chest pain or a discomfort in the chest. This chest pain can be either a central chest pain or could be a heaviness of the chest, or the pain can radiate to the neck, can radiate to the shoulder, or can radiate to the left arm. So this is usually brought about by when you do or when you walk fast or when you climb stairs. So that is one common symptom of heart disease. Other symptoms are when you do some exercise, you feel out of breath. When you climb the stairs, you feel breathless, or you can have palpitations, or you can have undue fatigue when you're doing work. These are some of the early symptoms of heart disease. Many of the early symptoms of heart disease are not taken seriously by the patients because as they feel it is unrelated to the heart. The chest pain may be thought to be because of acidity or could be thought to be because of a muscular pain. Breathlessness, people attribute it to lack of exercise or because they are overweight. So many of the symptoms are ignored at the beginning. Now let us see what are the risk factors for development of heart disease. The major risk factors for heart disease, one is hypertension, second is cholesterol, which is also very common among the people. Then third is diabetes, fourth is smoking, and fifth is strong family history of premature heart disease. Many of the diseases which I told you, they start in the 20s and 30s. So when people are diagnosed to have elevated cholesterol, elevated blood pressure, they are very much hesitant in starting treatment, as they feel that as the disease is not symptomatic, there is no need for medication. But people fail to realize that these diseases lead on to heart attacks. So it is very important that such diseases be diagnosed early and proper treatment should be taken. So how can you diagnose heart disease early? Evaluation for heart disease is usually done in people who have some symptom related to the heart, like chest pain or breathlessness or palpitations. So the initial investigation would be some blood test to look for diabetes, to look for cholesterol, and look for other problems which may affect the heart. The next step would be to take an an ECG or electrocardiogram. In the ECG, you may be able to see some subtle changes which may point towards an underlying heart disease. But all heart diseases may not be picked up with an electrocardiogram. So, if you strongly suspect a heart disease, you need to go for an echocardiogram. In the echocardiogram, the structure of the heart can be visualized, the valves can be visualized, how it is functioning, how the heart is pumping, and whether there is any abnormality in the function of the heart can be analyzed. So that is a more effective test to diagnose heart disease. And if you strongly suspect a heart disease, you can go for a stress test or a treadmill test. Here, the patient is connected with leads to the machine and the patient is made to walk on the treadmill. So when he exercises, if there's an underlying heart disease, changes can be seen in the ECG and a diagnosis can be made. We can diagnose a heart disease and the patient can be referred for a CT angiogram or a coronary angiogram. Now let us see how we can prevent heart disease. The first and foremost is to change your lifestyle to a better lifestyle. You need to reduce certain things. The first thing that you need to reduce is to reduce your caloric intake. You need to reduce high carbohydrate foods. You need to reduce high fat foods. So that is most important. The second thing you need to reduce is your levels of stress. You will have high stress levels at work. You may have high stress levels at home. So these stress levels, if you can reduce it, that will improve your cardiac health. The third thing to reduce is to reduce your body weight. Nowadays, we find many people are overweight or obese. So if you can reduce your weight, that will reduce all your other risk factors for heart disease. Then certain things you need to increase in your life. That is the exercise that you do daily. It is ideal that you do some exercise for at least 30 to 45 minutes a day, at least 5 days in a week. If you have any of these symptoms of heart disease, you can come over to Abeer Medical Center and undergo a comprehensive cardiac evaluation to see whether you have a heart disease or not. Even though heart is a very small organ, it is one of the vital organs in our body. So its health is very important and it is everyone's responsibility to maintain the good health of their heart. So as part of the World Heart Day Awareness Program, I urge all people with these cardiac symptoms to come forward for a cardiac evaluation. All the advanced cardiac tests are available in our clinic. You can come and avail our services. As you know, prevention is better than cure and a stitch in time saves 9. So act fast and act early. Thank you.